Exposure to blood-borne diseases is a serious concern in the healthcare industry. Because of this, in 1991, the Occupational Safety and Health Administration created a new regulation dealing with blood-borne pathogens, the disease-causing microorganisms found in human blood, as well as human blood components and products. While there are a number of blood-borne pathogens, those causing hepatitis B, hepatitis C, and the human immunodeficiency virus pose the greatest threat. Human immunodeficiency virus, or HIV, is one of the newest blood-borne pathogens and is spreading rapidly. It is believed that over 1 million people in the U.S. have already been infected. Currently, no vaccine exists to prevent infection of HIV, and there is no known cure. Symptoms experienced at the onset of HIV infection can vary. They include weakness, fever, sore throat, nausea, headaches, diarrhea, and other flu-like symptoms. However, many people with the HIV virus show no apparent symptoms for years after their initial infection. Controlling the spread of HIV is very important. It is generally believed that those who contract HIV will ultimately develop acquired immunodeficiency syndrome, or AIDS. AIDS results in a breakdown of the immune system, canceling out the body's ability to fight off other diseases. Hepatitis is a liver disease. It usually results in an inflammation of the liver and frequently progresses to more serious conditions, including cirrhosis and cancer. Each year in the U.S., there are over 70,000 new cases of hepatitis B, the most common type of viral hepatitis. And it is estimated that more than 3 million people in the U.S. are carrying the hepatitis C virus. In fact, the prevalence of hepatitis is so widespread that it is quickly becoming a larger transmission hazard than HIV. While there is no cure for hepatitis B or hepatitis C, a vaccine does exist that can prevent hepatitis B infection. After exposure, it can take 4 weeks to 6 months for hepatitis B to develop. Early detection is extremely important, since vaccinations begun immediately after exposure to the virus can often prevent infection. The initial symptoms of both hepatitis B and hepatitis C resemble those of a mild flu. There is a sense of fatigue, nausea, loss of appetite, and possible stomach pain. Often, jaundice, a distinct yellowing of the skin, will eventually develop, as well as a darkening of the urine. However, as with HIV, people infected with hepatitis will frequently fail to show symptoms for weeks or even months. Blood-borne pathogens are most often transmitted parenterally. This is when microorganisms present in a substance are accidentally injected into a worker by a contaminated sharp object. These exposures most often occur through punctures from infected needles or human bites. Other ways of transmitting blood-borne pathogens include skin abrasions or cuts contacted by potentially infectious material, such as blood, human tissue, vaginal secretions from discarded hygiene products, and other body substances with blood in them. Cultures and body substances visibly contaminated with blood must also be considered potentially infectious, as must any body fluids and materials of unknown origin. Materials taken from infected lab substances may also carry blood-borne pathogens. Preventing parenteral exposures to these materials is one of the major parts of the OSHA blood-borne pathogens regulations. Let's take a look at what the regulation requires of your facility. The first step involves the creation of an exposure control plan. This plan spells out how your facility will address the requirements of the regulation itself and includes a determination of each employee's potential exposure to blood-borne pathogens and an examination of ways to limit or eliminate exposure. The exposure control plan also deals with setting up a hepatitis B vaccination program, as well as procedures to be followed whenever an accidental exposure occurs. Other parts of the plan include warning signs and labels, employee training, and the keeping of necessary records regarding exposure, vaccination, and training. The plan must also incorporate the use of standard precautions, which treat all human blood and other body substances as if they are known to be infectious. If you work in the healthcare industry, one of the most critical issues the plan addresses is how to reduce the risk of needle sticks and other sharps injuries. The Centers for Disease Control, or CDC, estimates that there are over 500,000 injuries from contaminated sharps each year. Unfortunately, when these injuries involve infectious agents, such as hepatitis or HIV, the affected workers are at risk of contracting blood-borne diseases. One of the things OSHA has done to help combat the danger of needle sticks is to mandate that exposure control plans be re-evaluated at least once a year. A major focus of these reviews is to make sure that your facility is using every means available, including updated work practices and the use of the latest needle-less technologies to keep you safe. As a rule, the review must show that the exposure control plan reflects changes in technology that can eliminate or reduce exposure to blood-borne pathogens, documents investigation and implementation of new medical devices that are designed to reduce or eliminate occupational exposure, and incorporates the opinions of frontline employees whose interactions with patients expose them to potentially contaminated sharps. If you would like to look at your facility's plan, see your training instructor or supervisor. Now we will take a closer look at the most important parts of that plan. Labeling is the most visible requirement in the regulations. Containers carrying any potentially infectious materials, such as blood, must be marked with a biohazard label. Labels must also appear on any equipment and materials suspected of being contaminated. The word contaminated indicates the presence or anticipated presence of potentially infectious materials on an item or surface. Biohazard labels are fluorescent orange-red with the biohazard symbol in a contrasting color. The word biohazard is also marked on the lower portion of the label. Red bags or red containers can substitute for these labels. There are several exceptions to these labeling requirements. Individual containers of blood do not have to be labeled if they are placed inside another labeled container for transport or storage. Facilities following standard precautions in handling all specimens do not have to use this type of labeling if the specimens are recognizable by the employees who normally handle them. Labeled blood products released for transfusion or other clinical use are also exempt as long as these specimens remain in the facility. Common places that you will see these labels include refrigerators and freezers containing blood or other potentially infectious materials, containers used to store, transport, or ship these materials, contaminated equipment awaiting cleaning, as well as containers of regulated waste. Regulated waste refers to several things, including potentially infectious materials, such as blood, contaminated items, such as bandages, bedding, and towels, contaminated sharps, including needles, scalpel blades, and broken glass, are also considered regulated waste, as well as containers which may have had infectious material in them. Your employer has compiled lists of job classifications and activities that may present risk of exposure. These lists can be found in your group's exposure control plan. There are many ways you and your employer can work to reduce exposure to blood-borne pathogens. These include the use of standard precautions, remembering to treat all blood and body substances as if they are infectious, engineering controls, work practice controls, the use of personal protective equipment, and appropriate housekeeping practices. Engineering controls refer to equipment or machinery that can minimize exposure. Your facility uses many of these already, such as puncture-resistant sharps containers, self-ventilating laboratory hoods, and sharps with engineered injury protections, such as self-sheathing needles. Work practice controls reduce the potential for exposure by focusing on the safest ways to perform tasks. Hand washing is one of the most important. If you have been involved in a situation where you may have been exposed to blood-borne pathogens, OSHA requires that you wash your hands immediately after removing gloves and personal protective equipment. Remember to wipe off the spigot with your towel when turning it off, so you don't recontaminate yourself in the process. You must also wash your hands immediately after contact with blood or other potentially infectious material, as well as rinse your eyes, nose, or other mucous membranes with generous amounts of water if they have been exposed. Other work practices are also addressed by OSHA. Be sure to minimize any splashing, spraying, or creation of droplets when dealing with potentially infectious samples. And remember, no mouth pipetting or suctioning is permitted. During handling or storage, specimens must be placed in appropriately labeled leak-proof containers. Appropriately labeled secondary containers must be used if the outside surface of the primary container is contaminated. If there is a danger that the specimen could puncture the primary container, the secondary container must be puncture-resistant as well as leak-proof. OSHA considers housekeeping practices to be very important to the control of exposure situations. Written cleaning schedules specifying methods of decontamination must be maintained to keep all areas clean and sanitary. If they are obviously contaminated, work surfaces must be cleaned immediately with an appropriate disinfectant. Otherwise, this should be done at the end of each work shift. Protective coverings on equipment, such as plastic or coated absorbents, must also be replaced when contaminated. There are several work practice control requirements regarding contaminated needles and sharps. They must not be bent, and they cannot be recapped or removed unless there is no feasible alternative. If they have to be recapped or removed, you must use a one-handed technique or a mechanical device. Broken glassware is not to be picked up by hand, but by using a brush and dustpan, tongs, or other tools. Contaminated sharps must be discarded as soon as possible into appropriately labeled containers that are closable, puncture-resistant, and leak-proof. These containers must be easily accessible. They must be left upright, replaced routinely, and never overfilled. They must be closed when handled and are subject to the same secondary container requirements as specimens. Another part of the regulation concerns contaminated laundry. Laundry should be handled as little as possible and always bagged appropriately. It must never be sorted or rinsed at its originating location. Labeled or color-coded bags are required to transport laundry. Bags must be leak-proof if the laundry is wet and shows a potential for soak-through. Of course, all laundry must be handled with gloves and other appropriate protective equipment. OSHA also addresses personal workplace activities. Never eat, drink, or smoke in work areas where exposure may occur. You should also never apply cosmetics, lip balm, or contact lenses while in these areas. And food or drink should never be stored in laboratory refrigerators or freezers. The last type of workplace control the regulation addresses concerns equipment. Before any piece of equipment is serviced or shipped, it must be inspected for contamination with body substances. Any required disinfection should be completed as soon as possible. Remember, if the equipment cannot be totally decontaminated, it must remain labeled as a biohazard. All employees or service personnel who may come in contact with the equipment must be notified of the location and type of contamination. The use of personal protective equipment is another important part of the bloodborne pathogens regulation. It must be worn whenever there is a chance of exposure to blood or other potentially infectious material. Gloves are mandatory in these situations. Disposable gloves should be replaced as soon as possible after becoming contaminated. Never attempt to decontaminate and reuse them. Replace disposables immediately when they are torn or otherwise damaged. Removing rings before putting on your gloves will help keep them from tearing. Utility gloves, usually rubber or vinyl, are heavier and can be reused after decontamination. However, they must be discarded if they are cracked, peeling, or otherwise damaged. Remember, you must change gloves and wash your hands after each exposure. If you are sensitive to latex, talk to your supervisor. Non-latex PPE will be made available to workers with documented latex allergies. Masks and eye protection should be worn whenever there is a chance that fluids may splash or splatter. Standard safety glasses protect the eyes from direct exposure from the front. Side shields provide added coverage. Safety goggles fit snugly and provide complete protection of the eye region. Face shields protect not only the eyes, but the rest of your face as well. Pocket and other face